Good day and welcome to Abrahay Bantay Calamidad Online Symposium of the Youth for Environment Schools Organization or YESO. I am Margo Bernardine Agudal, school nurse. I will be discussing information about coronavirus disease 2019 or COVID-19.
Rub your hands. With soap and water, wash your hands. We need to clean our hands. Virus, go away. I don't need you anyway. Little Pia must be healthy. Virus, go away. COVID-19, go away. We never need you anyway. All the children must be healthy. Virus, go away.
Until now, we continue to be in the midst of a pandemic, but so far, health protocols have allowed us to cope with the pandemic. As of March 2, 2021, there have been 580,442 confirmed cases of COVID-19 in our country, with 12,369 deaths and 543,463 have recovered. So what is coronavirus disease 2019 or COVID-19? Coronavirus disease 2019 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. So what are the signs and symptoms of COVID-19? People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. It includes cough, shortness of breath, difficulty breathing, fever, chills, muscle body aches, vomiting or diarrhea, and even loss of taste or smell. And according to researchers in China, these were the most common symptoms among people who had COVID-19. 99% had fever, 70% experienced fatigue, 59% had cough, 40% experienced lack of appetite, 39% had body aches, 31% experienced shortness of breath, 27% had mucus or phlegm. And some people who were hospitalized for COVID-19 had also had dangerous clots, blood clots, including in their legs, lungs, and arteries. So how does COVID-19 spread? COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within about 6 feet. People who are infected but do not show symptoms can also spread the virus to others. And cases of reinfection with COVID-19 have been reported but are rare. People who are physically near a person with COVID-19 or have direct contact with that person are at greater risk of infection. When people with COVID-19 cough, sneeze, talk, or breathe, They produce respiratory droplets. These droplets can range from larger droplets to smaller droplets. Who are at risk for coronavirus disease? Any one of us can get COVID-19 and most infections are mild. The older you are, the higher your risk of severe illness. You also have a higher chance of serious illness if you have one of these health conditions. This includes chronic kidney disease, chronic obstructive pulmonary disease or the COPD, a weakened immune system, obesity, serious heart conditions, sickle cell disease, and even type 2 diabetes. So it is important to protect yourself and protect others as well. And the best way to prevent illness is to avoid being exposed to this virus. So here are the preventive measures to take to protect yourself and others. 1. Stay at least 6 feet away from others whenever possible. This is very important in preventing the COVID-19 spread. Another one, cover your mouth and nose with a mask when around others. This helps reduce the risk of spread both by close contact and by airborne transmission. Another one is hand washing. Hand washing, you have to wash your hands often with soap and water. And if soap and water are not available, you have to use a hand sanitizer that contains at least 70% isopropyl alcohol. Another one is to avoid crowded indoor spaces, and you have to ensure indoor spaces are properly ventilated by bringing in outdoor air as much as possible. In general, being outdoors and in spaces with good ventilation reduces the risk of exposure to infectious respiratory droplets. Another one, you have to stay at home and isolate from others when you are sick and when you experience any of the symptoms. And lastly, routinely clean and disinfect, frequently touch surfaces, and take other steps to stop the spread at home. Who should get tested by COVID-19? 1. People who have COVID-19 symptoms. 2. People who have had close contact with someone with confirmed COVID-19. People who have taken part in activities that put them at higher risk for COVID-19 because they cannot socially distance as needed, such as travel, attending large social or mass gatherings, or being in crowded indoor settings. And lastly, people who have been asked or referred to get testing by their healthcare provider. Take note, not everyone needs to be tested. But if you get tested, you should self-quarantine or isolate yourself at home pending test results and follow the advice of your healthcare provider or a public health professional. Pandemics can be stressful, especially when you are staying away from your loved ones. During this time, it's important to maintain social connections and care for your mental health as well. Coping with stress is very important because this will make you, your loved ones, and your community stronger. And the best way to prevent or slow down the transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by following the preventive measures. So that ends my talk, and thank you very much. Together, let's beat COVID-19. Thank you.